All right, now's the time to answer some common health questions with News Channel 5's medical expert, Dr. David Soria. He is the Chief of Emergency Medicine at Wellington Regional Medical Center. As always, we look forward to seeing you. Let's dive in. What are the signs of Lyme disease? That's what one viewer wants to know. And how do you treat it?
Yeah, well, it's summertime, and so you hear more and more about Lyme.
Yeah.
You know, we see about 300,000 cases every year, but you know, that sounds like a lot. We don't hear much about it. It's caused by a tick bite. Most of us know that. That's infected with an organism named Borrelia. So what do you look for if you think you may have it? Well, the most common sign is a rash. It's called erythema migrans. It can happen anywhere in the body.
Okay.
Tick bite, you see a little lesion, and then what you'll see is like a target ring, looks like a bullseye. About 80% of the cases will have that. Otherwise, all you'll have is some fever, myalgias, a headache, maybe some arthritis, simple things, lymph nodes that are swollen, very difficult to identify. The good news, if you catch it early, antibiotic treatment, complete recovery, almost
So it's not something you can take an aspirin for or Tylenol?
No. Well, you can take that for its symptoms, but it's not going to cure the infection.
Lyme disease.
You got to have the antibiotic, you bet.
All right, next question. We're going to stick with the 4th of July theme. If a firecracker goes off in your hand, oh no. What's the best way to reduce the pain?
Yeah, well, you know what, no matter how often or how much we talk about this, unfortunately, we will still see some careless and preventative injuries this weekend, no doubt about it. You know, fortunately, most of them are going to be simple, minor, first degree, but we will see some serious ones. And typically what I want you to look for is this. Look, if you have charred skin, peeling skin, large blisters, or if the burn goes all the way around your finger, that could be serious and cause permanent damage. Right? Make sure you come see us in the emergency department. Hands down, don't want you to treat that on your own. But if you feel it's minor, or for all other injuries, first degrees, just see a little redness, right? And hopefully that's all. If we see anything, that's all we'll see. Treat that with cool water. Let your hand run under cool water, not ice.
Okay.
Cool
Not
water,
ice.
20 minutes, dry it. Topical antibiotic ointment, and then ibuprofen or Tylenol.
And that's why I just stick with the sparklers.
You know what? Go to the show and watch.
And just watch, right? If you have a question for the doctor, you can send it in by going to our website, wvtv.com. Click on the health link, scroll down. On the right-hand side, you're going to see a form to write your question. As always, we look forward to your questions. Thanks for coming in. We'll see you next week. We'll be right back.